The purpose of the health assessment is to gather information and to identify the patient's needs. I will ensure your privacy by closing the curtain, and I will perform hand hygiene. Could you please tell me your name?
Adriana.
Can you please tell me your date of birth?
12/02/1996.
And your age?
24.
Okay, perfect. Do you know where you are right now?
Yes, at the hospital.
Okay. Can you tell me the year?
2021.
Can you tell me the month?
February.
Okay. Can you tell me if you're allergic to any medication, the environment, or any food?
No, I'm not.
Perfect. And if you have any pain right now, on a scale from 0 to 10, how would you rate it? 0 being no pain and 10 being the worst.
No pain. 0.
Okay. Okay. The patient appears to have a good hygiene, has a good level of consciousness, and appears state at age. I will be taking your pulse. I will also be measuring your heart rate and taking your blood pressure. Okay. Can you please uncross your legs and keep your feet flat on the floor? I will perform the taking the blood pressure by the two-step technique, and I will also be taking her pulse and heart rate at the same, well, not at the same time, but simultaneously. That way she doesn't know. Let me take your heart rate. Okay. You have a heart rate of 78 beats per minute and respirations of 18. That is the normal finding. Now we'll be taking your blood pressure. The patient's pulse disappeared at 120, so I'm gonna add 30 to that, and I'm gonna inflate the cuff at 150. Okay, your blood pressure is 122/82. Can you tell me a little bit of your skin? Have you noticed any changes in your skin texture, your skin color, any changes in your molds?
No, no changes.
No changes, everything's the same?
Pretty much.
Okay, can I look at your skin? Okay. Have you noticed any swelling in your legs or in your arms?
No.
No. Okay, good. Patient skin looks good, and no swelling. What about any drainage in your ears?
No.
Do you have problems hearing?
Mm-mm.
What about problems with your eyes? Do you wear glasses?
No, I don't.
Any drainage in your eyes?
No.
What about in your nose?
No.
And drainage, what about in your mouth?
No.
Do you have any sinus problems?
No.
Do you get frequent colds?
No.
Any problems breathing?
No.
Okay, let me put on my gloves. That way I can assess for your hair, inspect your hair. I was gonna ask you, have you noticed any changes in your hair, the texture, any patches,
Mm-mm. No.
losing hair?
No.
Okay. I will inspect your hair for pediculosis, head lice, as well as for any lesions.
Okay.
Okay. And bring your head back up. Perfect. When I touched the patient to assess her skin, she felt warm to touch. Okay. What about any problems with your nails?
No.
I'm gonna check for capillary refill.
Okay.
Okay. Other hand. Good. Okay. Patient's capillary refill is less than 3 seconds. And now I'm gonna assess for clubbing. Go ahead and do this for me. Okay. Next. One more. Thank you. Patient does not have any clubbing in her fingernails. Let me get my pen lights. So no problems, no drainages in any parts of your face?
No.
Okay. I was gonna ask you to look straight into the light. Okay. Now I'm gonna assess for your cardinal fields of gaze. Follow my pen. Perfect. Patient's ears, eyes seem symmetrical to her face. There are no problems with her nerves. She followed my pen throughout the whole areas, and her pupils appear to be equal, rounded, and reactive to light and to accommodation. And I'm going to assess, inspect your ears, your nose, and your mouth.
Okay.
Okay. Remove your hair. Okay. Go ahead and look up for me. Perfect. Now you're gonna open your mouth, stick out your tongue, say ah. Good. Okay. Now I'm gonna have you stick out your tongue one more time and move it side to side. Other side, up and down. Okay, good. Now I'm going to assess your range of motion. So can you lift up your shoulders like this? Okay. Can you lift up your left hand, right hand, out to the side, and try to reach back. Okay, other arm, to the side and back. Okay, patient has good range of motion in both of her shoulders. Now I'm going to assess to see if she has any problems in her cranial nerves of her face. Can you pucker? Can you smile? Perfect. And let me have you pull your eyelids down. Going to assess for your conjunctiva. Okay, perfect. And okay. So now I'm going to assess for your trachea. Go ahead and look up for me. Okay, go ahead and swallow. Trachea appears to be good and patient has no issue swallowing. And your tonsils. Let me see your tonsils one more time. Okay. Patient's oral mucosa seems pink and the tonsils are not red or swollen. Also, her tongue does not have any lesions. Okay. Go ahead and have a seat here in the chair. I'm going to inspect your TMJ right here to assess your jaw. Go ahead and open your mouth and close. Okay, any pain with that? Okay, perfect. And let me now assess for your lymph nodes. Have you noticed any of your lymph nodes getting enlarged or tender?
No.
Okay. Patient's lymph nodes appear to be good. They're not fixated or enlarged. Good. Have you noticed any changes in your sense of smell or taste?
No.
Okay, I'm going to assess your AP ratio. It should be 2-1, okay? Okay, patient's AP ratio appears to be within the normal range, 2-1. And okay. So what I'm gonna do now, go ahead and have a seat back here. Let me see, I'm going to assess for the patient's brachial pulse. And your arm. Good. Okay, arm. Okay, perfect. Now I'm going to listen to different areas of the heart. Patient's aortic valve seems to be perfusing. Also her pulmonary. Tricuspid and mitral valves are resonant. Now I'm going to assess for the patient's lungs, anterior, posterior, and as well as in the side. Take a deep breath in for me. Again. One more time. Last time. Okay. Here, please. Move your hair and move it. Okay. Deep breath in. Again. 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 Okay, perfect. I'm going to assess the weight on your side. Breathe in. Breathe out. In and out. Hard. Good. In. And one more time. Okay. While I have you sitting down right there, can you please scoot back? And I'm going to assess for your reflexes in your knees, your ankles, and a Babinski reflex, okay? Okay. Can I have you take off your shoes? Okay. This is gonna be for the Achilles reflex. Okay. Next one. Good. And I'm gonna take off your sock, and I'm gonna use this part of my hammer. Okay. As well, let me assess for your clubbing, for your capillary reflex in your nails. Okay, good. Now, okay, and let me assess for your capillary refill in your toenails. Okay, good. The patient has good capillary refill in the her toenails. And now I am going to assess for her range of motion in her wrist and as well as her ankles. Let me see in your ankles. Was any of these motions hurt?
No.
Okay. Next one. Hurt?
No.
Any pain? Okay. What about in your wrist? Go ahead and have them like this. Lift up, down, out, and in. Okay. Any pain? Circles, other way? No pain?
No.
Patient does not have a good range of motion in her wrist as well as her ankles. And now let me apply a little bit of resistance. So now you're gonna try to go push against me. Okay, other way. This one. Good. Try to lift up and try to push me down. Other one. Push me down. Lift up. Okay. Extend your arms and I'm gonna try to push you down, okay? Don't let me push you down, so you're gonna push up. Go. Okay, other way. Good. Squeeze my hands as hard as you can. Good. Patient has good strength as well as range of motion in both wrists and shoulders. Okay, so now I'm going to have you lay down and I'm going to auscultate for different areas in your abdomen. I'm gonna take off your shoes, okay? Your legs up. Okay. So I'm going to inspect in different areas of her abdomen. Okay, good. They look good, no lesions or any scars. So now I'm going to auscultate in different areas of your abdomen. Right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay, everything seems normal. Now I will perform light palpations as well as deeper palpations. Do you feel any pain?
No.
Okay, so now I'm going to go in a little bit deeper. You let me know if you feel any pain. Okay. Okay. And what I'm gonna do now is I'm gonna percuss in different areas of her abdomen. Can you have your arms to the side? Thank you. Okay. Now, laying down, I'm going to assess your range of motion and your strength in your lower extremities. So what I'm going to have you do, go ahead and lift or raise your right leg up. Okay, perfect. Now bring it down. And I'm going to apply a little bit of resistance, so don't let me push you down. Go ahead. Good. Now lift up your left leg. Good. Now down, and I'm going to apply resistance now. Go ahead. Good. Okay. So now what you're going to do, because I'm going to assess your hips, go ahead and bring your right knee towards your chest. Good. Left. Good. Any pain with that?
No.
All right. And now I'm going to percuss on your back for your CVA. Go ahead and sit up one last time. Okay. Let me know if you have any pain.
No. No.
Okay, good. Okay. So now I'm going to palpate for your carotid pulses. Good. Okay, good. And now I'm going to palpate for your apical pulse, which is located midclavicular fifth intercostal space. Okay. Lastly, do you have any issues walking? Have you noticed any limping, pain?
No.
No? Okay, I'm gonna have you walk back and forth for me. Let me know if there's any pain. Okay, any issues with that?
No.
Okay, go ahead and have a seat one more time. And I forgot about your pedal pulse. Go ahead and put your leg up here. And this is for your pulse. And then remove the sock. Okay. The next one, right here. Remove your sock. Okay, good. Have you noticed any changes in your bowel movements?
No.
How do you go to the restroom?
Once a day.
Have you noticed any changes with your weight? Have you lost or gained any weight?
No.
No? Okay. What about in your urine when you go pee? Do you have any odors, any blood in your urine?
No, nothing different.
Okay. And how much water do you drink?
Like 4, 5 cups a day.
Okay. I'm going to assess for your skin tartar to see if you are dehydrated. Good. All right. Do you have any problems with your activities of daily living, like going to the grocery store, getting in and out of a car, showering?
No.
No? All right. Well, with that, I will conclude my assessment. Do you have any questions for me?
No.
Okay. Well, thank you so much for your time. Would you like me to leave the lights on or off for you?
On our fine.
Okay. Well, thank you.